Thank you for reminding me to record that. So you can just tell when you get here the access to tap into the larger economy what you have. Not only do you have, will you land in the first largest economy in EU, you will also have access to the other 27 member states that are in here working together because the EU have their agreement and many things countries are working together in certain aspects. Okay, so here also you have you don't have such a bad living standard. The living standard is quite okay, and the work-life balance is also acceptable. And the social system mostly is the one that is um, a boomer for me. There is real social system. If you can tell, the social system, especially from back home in Namibia, are the family members. We have to take care of our elderly people. But here, the social system within the government, it's amazing what it can cover for. Um, there is also safety and security here. I think Germany tolerates quite a lot looking at what is happening either culture wise or political wise or religious wise, I think it's much more tolerable than many other countries that I have experienced. We all live together with our different religions. And then everybody is mandatory to have a comprehensive health insurance system. So you can just tell what it means for you that you are compulsory health insured. And there is also legal protection. The Constitution protects every human being that is here. So it's not only a lawless country, it's a country that enforces law as well. So, and then when you get employment, you will be getting residency permit to be able to access also other European country, like I mentioned in the beginning. Okay, so now I'm going to specifically talk about the requirement qualification again, just to emphasize that enough, the process. So first, we look at what qualifications you have and how we can make your journey for this process. We basically zoom into you and look at what qualification you possess right now. Everybody join the class with um, join the program with different qualifications. People are different in the way they are qualified, whatever they need in life. Some people want to study, some people want to work, some people want to be trained. So everybody's journey is different. And then before somebody gets on our program, we do have that opportunity to talk to you on one so we can really understand what we can do for you. So, and then first qualification is obviously you have the willingness and the desire to take up the new opportunity, and then you are not older than 45 years of age, and you will, depending on what you are going to take, what position you are going to be able to take, B2 preferred. Some jobs require a B1 language proficiency, and this certificate that you need, the language proficiency, should be issued by a recognized institution. And I have done my research. There are two institutions that are accepted to give this certificate is Gute Center and TELC. But I've done my research. I've only seen Gute Center in Uganda. People can tutor, we can all tutor, but we are not allowed to give you a certificate that is recognized here. The certificate need to be done through one of those recognized. Yes?
Yes, your voice is a little bit low. People are struggling to listen to you.
Really?
Yes.
And what about now?
Yeah, I'm able to hear.
Okay. Sorry, my voice is also gone. So, well, this is now what I was saying. You need a German proficiency at a certain level, depending what you want to take up. So, mostly people used to take A1, but A1, nobody wants it anymore. The lowest that in certain careers that one needs is A2. But those are mostly au pairs and people that would like to do a gap year or voluntary year. But mostly what is required for people that are jumping on the job, it will range from B1 and B2. It depends. You can just imagine if you want to climb up the ladder, you must be able to uh, express yourself. You must be able to talk. And to be able to talk, you need a high level of the German language proficiency. And like I repeat again, there are two centers that can offer a recognized certificate that is accepted. Is the Goethe Center and the TELC. The TELC is not so much in a lot of African countries, but you have the Goethe Center, last time I checked, in Uganda. So what we do, we tutor, and then exams are written in one center. That's all I wanted to say, and that's what I I I repeated. So I can pause a little bit. Maybe there are a few questions that we can somebody is having. The salary expectation for this one is geriatric care. The salary expectation is ranging from 1,100 to 2,900 per month for the case. I'm not talking about the qualified nurses, registered nurses. I'm talking about the geriatric nurse.
Okay, thank you very much. I can see Mary's hand is up and Masiko. I think they have something to say. Mary, you can come in.
Sorry, I raised my hand because Madam had asked how many of us are not employed right now. That's something that.
Okay, I see Dr. Mayanya.
Yes, I think I'm clear. Thank you so much. Dr. Evelyn, I was inquiring about, you talked about the conditions for nurses, and I've not heard about medical doctors, probably, who are interested in pediatric medicine. Probably talk about it later. I'm not sure.
Yes. Okay. All I know, we mostly we have somebody that is a medical doctor, the couple, they are medical doctors already and they are already here. So they just joined our German course because they want to work in their career. It depends what your curriculum entails. in your medical career. For example, I know the nurses that are coming from Namibia. When they come from the University of Namibia, they do not need to add anything. So uh, their qualification are in the framework and they are happy. So all they do is just, you need to be registered with the Medical and Dental Council. So when they come here, they only do that course to be registered with the Medical and Dental Council of Germany. So the doctors would need the same, but also they zoom in and see what did you cover in your unit, your course outlines as well. Okay, now we can go back. Um, I can't stop talking enough about Keomed because we are under the banner of Keomed. We have a lot of partners, like I mentioned before. We collaborate with a lot of people, and then we are seeking also to collaborate with our partners in Uganda, and that's where we are now. That's why we are here now. We are already having people that we collaborate with in Namibia and in many other countries as well. So, and this collaborator, they can make your journey easy to come and to Germany. So we also form collaboration with the German language tutors. We also have our own tutors, but if we have bigger groups, we have people that come in and teach also German. We also partner with employers here. For example, we partner with AVO. It's a huge organization, AVO. They have footprints throughout the whole country. I don't know how many hospitals do they have, and that's organization that we partner with. We partner with Caritas. They have huge footprints in the whole country, hospitals, and all that. And this is what we partner with. So we have existing contracts with those people. All we need to give is um, to train our people to come to a level that is accepted, and so you can come and do your work here. Obviously, most of our people that we train are outside is Gute Center, so we book our our exams for our students with Gute Center, and they come here, so they are already booked the. So also, like I spoke to Avo, I spoke about Avo. I spoke briefly about some university in Hamburg, university in Bremen, University of Technical University in Berlin. So those are all universities that we work with. We have a small project with a university in Cologne, and basically, yeah. Obviously, we do a lot of work with the University of Namibia and also Namibia University of Science and Technology, also back home. So basically, our whole work is about collaborating with the in-country person or with whom we want to work. As I told you, um, I've been to Uganda more than 3 times. It's a, it's a, it's almost a home for me. So, and that's why we would like to collaborate and get to work with Uganda as well. Okay. Um, that's here and now. So again, here are some answers that you need to qualify to come here, and the steps that you what it takes you to qualify. I said you need to have the willingness. You need to be of that age. Um, Ideally, if it's a specialized qualified something, then the age can be. But if you want to be into the training, we suggest that you should be uh, not older than 45 years. But if you have a highly skilled, like you say, doctors and all those are people that are looked at a certain level. I forgot to say we also started collaborating with Deutsche Bahn. Is like a parastatal that 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 is responsible for the railway, and they have around 400 companies under them in many aspects, logistics, IT, whatever, maintenance and stuff like that. So this is just the new terrain that we went in as well now. And so, but the main thing is no German, no work. So that's basically the whole thing, the whole catch with all this type of things. And we are here to make it possible. So I just want to give you the list of what happens now. You attend the online session, and this is what you did now. You submit. We awaken your willingness to join the program, and then you sign a contract. You learn German, and then when you learn German, depending on your journey where you are going to, um, like most people now, especially we have a group of some registered nurses from Zambia and Zimbabwe and Namibia, a group of them. They are already when before you get to the level, the last level, you start already talking to your prospective employer. We do not sign a contract. I want to make it, we do not sign a contract on behalf of you and we are paying you your salary. No, we put you in touch with the organization that you are going to work with, and your contract will be signed directly with them. And with all this paperwork is what you need to facilitate your visa. But for us, it's very important that we get to know you in the German class. We see your seriousness. We get to know you a little bit. So when we refer you to the company, at least it's somebody that has been working with us for a while that we know. Because we used to get people, and when you don't know the people, then it's a little bit tricky. So you submit your application to us, and the prospective employer will also, after you are now with us, will send your CV already. We will help you how the CV should a little bit look like in Germany. And once the team has reviewed your application, they will speak to you about the nitty-gritty things, details, and you will sign a contract with now Keomed to be on the program. And you start your German language journey. You will receive support from the German language trainer, and you will then sign an employment contract when that time comes. It basically happens just a few levels before you start engaging, getting to know your prospective employer. One level before you reach. I think I'm even having some people here that has been in our program. I see Ashley here. Ashley is studying already here. She can maybe also just talk about the way. And I see Tali here. Tali is also about to go. Her suitcases are almost packed, if not already. I pack early, but I don't know whether she's the last minute person. So once you will get all the assistance and all the paperwork that you need, and then your visa application go. And then we will only be monitored and getting where we need, but then the correspondence has already started with your prospective employer or with your prospective person that you work with. So mostly, if you are a qualified person, depending on what you have, qualification, the nurses that we do have some nurses here that are leading organizations. But for you to be able to lead, you must be able to express yourself very well, write reports. You can just imagine if you don't know how to talk, well, how can you lead? How can you get a very a responsible position? And that's the catch. So most of the people that we have, some nurses, they go through that IHACA training for 4 months. Some are taking 12 months. I don't know. When they miss something, and then they have that upskilling that they need, and they are good to go. But we do have some wonderful girls here, like two. They are head of departments already. Um, so everybody's journey is different, and if you know what. So most of our people that we work with, organization, it depends. Everybody is their own journey. Some people have ticket booked. Some people, I think at the university, I think tickets are not paid for. Um, Ashley will just tell me a little bit, but everybody's journey is different. So, um, yeah, and then after you go through all those processes, then there's no problem for you to be here. Um, I advise if you have a family back home, is ideally, and if you have some upskilling to do, I would suggest that you leave them home for a while until you finish your upskilling before you bring them here, because it will just be a hectic year in the beginning. Most hospitals, they do give temporary accommodation for 12 months, and then after you are done, you would then go and look for your own accommodation. But like I said, nitty gritty and little simple things is different. People that are doing like IT and stuff like that, they get such a already a high salary, they are just referred to another accommodation. They don't go to a company's accommodation. But obviously, we are also here to help you with the nitty gritty things. So we give comprehensive support, like I said, for your career pathway to Germany, where we support, yeah, our online courses are 150 per level, USD per level. You know, you need level A1, A2, B1, B2, depending now up to which level you are starting. Um, um, and that will be our priority, and you will receive the information you need to decide whether this is the right path for you, for your career path to follow. And then you can reach out to us for any information that or any inquiry that you might have. And yeah, after that, we prepare you everything that we need. And sometimes we are asked to do quite a lot by the organization, that employer that we work with. So we just be at your service until you successfully reach here in Germany. Okay, so basically, I have just anticipated who covers my German language course. Obviously, it's you. And then who pays for my ticket? It depends where you are going. Sometimes it's the German company. In other instances, everybody's journey is different. It's sometimes it's shared, like people that are coming for au pair. Sometimes the au pair mother will say, we share, we split it, or they say, I pay it, and then you pay it off when you come here. So it's a different situation for everybody. Everybody is looked at um, in a different way. Who handles my visa application? Most people that we have dealt with, we handle the employer handle it, sometimes, but sometimes not in other careers, but mostly in the health sector, the employer is handling it. Who provides accommodation in Germany? I already spoke about that one, the 12 months. And who pays for my upskilling course? Obviously, the German company. And yeah, those ones are now from the health sector specifically. Other organization and other skills that came in, it differs. Health sector, you even get a bonus when you get here, just to the fact that you join the organization. But those are the things that we talk with one-on-one people. So I believe it's a one in a lifetime opportunity. And I think we will be here. We will know the journey, how to help you register your permit with relevant ministries once you get here, and then also schedule arrangements for you to have appointments so you can get everything. Remember, everybody's registered here have a residency registered permit. Those are the things that we do offline. And yeah, so we are just looking forward to be on this journey with you. And we give you a crash course also, just to understand a few things just days before your departure, so we can just be on the same level. And we facilitate where to go, a bank account or whatever, where the organization will tell us, this is the bank where we have our people. We can show you where it is, depending on the home where you are. So those are just the mandates that we are given by the employer to help you with. And basically, that is all.